Buenos dias, Zamboanga Peninsula. Welcome sa Kapihan sa Bagong Pilipinas. Hatid sa inyo ng Presidential Communications Office and Philippine Information Agency. Sa ating ika-6 na episode ay pag-uusapan natin ang patungkol sa kalusugan kung saan ilalahad ng Department of Health ang kanilang mga programa, serbisyo at ang mga napagtagumpayan sa mga nakaraang taon. Bago ang lahat, nais po nating anyayahan ng ating manonood na i-like, i-share at mag-comment po ng inyong mga katanungan via live stream po natin sa Facebook page ng PIA Western Mindanao and of course via Department of Health ZPCHD Facebook page. And of course, we would like to acknowledge all our media partners na kasama natin ngayon dito sa Zamboanga City sa ating venue at sa mga tumututok sa atin ng live mula Isabela City, Zamboanga Sibugay, Zamboanga del Sur, and Zamboanga del Norte. Hindi na po natin patatagalin ang ating programa at gusto na po nating i-present ang ating mga resource person for today's episode. We have the Regional Director of Department of Health in Region 9. Makakasama natin ang Dr. Joshua G. Brillantes. And together with him, we have Dr. Augusto Manolo Alpici, the Local Health Licensing and Enforcement, the Local Health Support Division Chief. Together with him is also Attorney Timothy Galvez, Regulation, Licensing and Enforcement Division Chief. And of course, last but not the least, Engineer Domingo Lusaya, the Management Support Division Chief. Kaya po pakinggan na natin ang mga accomplishment po, ang mga programa po ng Department of Health mula mismo sa Regional Director. We have a Dr. Joshua Brillantes.
Thank you, Mai. Buenos dias a todos. Isang malusog na araw sa Zamboanga Peninsula. We would like to welcome our media partners, our live viewers, and the Philippine Information Agency. Allow me to present the Department of Health Zamboanga Peninsula Center for Health Development's accomplishment for the year 2023 through an audio-visual presentation. Please watch.
In the last 3 decades, the Philippines has implemented various health sector reforms, such as the decentralization of health governance, delivery of financing of health services in 1991, introduction of the National Insurance Program, and the creation of the Philippine Health Insurance Corporation or PhilHealth in 1995, implementation of the Sin Tax Reform in 2012, passing of the Universal Healthcare Act in 2019, and specific reform strategies initiated by the Department of Health, such as the Health Sector Reform Agenda in 1999, Formula 1 for Health in 2005, Kalusugan Pangkalahatan in 2011, Philippine Health Agenda in 2016, and Formula 1 Plus for Health in 2018. Over the years, these health reforms facilitated the achievement of monumental organization and sector gains in the department with effects that were felt in the regions, including Zamboanga Peninsula. The year 2023 marks the 4th year since the passage of RA 11223 or the Universal Healthcare Act. This landmark legislation for the health sector continues to progressively realize universal healthcare in the country through a systematic approach and clear delineation of roles of key agencies and stakeholders towards better performance in the health system and ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and protected against financial risk. From the earliest beginnings of the nationwide UHC implementation in 2020, the province of Zamboanga del Norte was identified as one of the 58 provinces in the whole country known as integration sites. In 2021, it expanded to cover the 2 remaining provinces of Zamboanga del Sur and Zamboanga Sibugay. These provinces have committed to integrate their local health systems into province-wide and city-wide health systems and have undergone levels of progression in their local health system maturity level. From 2020 to 2023, series of UHC orientations, engagements with provincial health boards, memorandum of understanding signing, consultation workshops, and other activities have been conducted by the Zamboanga Peninsula CHD to shepherd the integration process. Unfortunately, In between these timelines of UHC integration, the country has experienced one of the most catastrophic health events in recent history, the COVID-19 pandemic. This event tested the health sector's resilience, stretched the capacities of government institutions and the private sectors, and overburdened health facilities and health workers. Further, it magnified the gaps in the health system. According to the 2022 National Demographic and Health Survey, the percentage of Filipino household members who visited the health facility declined from 8% in 2017 to 3% in 2022. This decline points to some limiting factors including availability, affordability, acceptability of services offered, as well as geography. The percentage of those who first visited the public medical facility for advice or treatment declined from 59% in 2017 to 44% in 2022. The percentage of those who first consulted the private medical facility rose from 40% to 55%, and this is attributed to a better perception of care of the said facilities. For Filipinos accessing public health facilities, almost half bypassed the primary level facility in favor of the hospitals. Despite these challenges, the implementation of the universal healthcare has presented a golden opportunity to be the North Star, guiding the health sector to deliver better ambulatory care services. In 2022, all three universal healthcare integration sites of Zamboanga Peninsula achieved the desired 70% of the local health system maturity level key result areas for the preparatory level. In 2023, the three UHC integration sites achieved 79% local health system maturity level key result areas for organizational level. This accomplishment surpassed the 70% performance indicator required for the year and covered all the 10 areas or characteristics required by the progression of maturity level, including unified governance of the local health system, strategic and investment planning, financial management, human resources for health management and development, information management system, epidemiology and surveillance, procurement and supply chain management, referral system, disaster risk reduction management in health, and health promotion. In support of the universal healthcare, the Zamboanga Peninsula Center for Health Development implemented various public health programs and other support that would provide interventions in addressing the triple burden of disease in the country: morbidity caused by infectious diseases, mortality by non-communicable diseases, and emerging injuries, mental health, alcohol, and drug abuse. The 2023 accomplishments are as follows. For maternal health, maternal mortality rate continued to decrease. In 2023, the region recorded only 17 maternal deaths, which is 35.56% lower than the annual performance target of at least 70 maternal deaths per total live births per 100,000 population. For family planning, percent demand satisfied with modern family planning methods is at 76.8%. For this accomplishment, Zamboanga Peninsula Center for Health Development performed 7.4% better than the 2023 target of 69.4%, and this is attributed to the sustained provision of pills, condoms, and other family planning commodities to all health facilities. For adolescent health, adolescent birth rate is at 20.99 per 1,000 live births against the 2023 target of 35 per 1,000 live births. For this, Zamboanga Peninsula Center for Health Development performed 14.01% better than the required target. For communicable diseases, in 2023, the province of Zamboanga del Sur has been declared malaria-free, making all provinces in Zamboanga Peninsula malaria-free. Leprosy prevalence rate achieved a positive accomplishment of 0.55% as compared to the target of less than 1% annually. Leprosy case detection rate also achieved a favorable accomplishment of 4.31%, achieving the 2023 target of less than 5% annually. Road traffic deaths per 100,000 population delivered a positive accomplishment of 1.76, thus achieving the target to reduce road traffic deaths from 8 to 4 cases in 2023. Trainings were provided for mental health to address rising cases of suicide in the region. Massive screening for cervical cancer and kidney diseases were conducted and referrals were made as necessary. Further, augmentation of essential drugs and medicines were provided for mental health, hypertension, diabetes, cancer, and others. Reading glasses were also provided under the Blindness Prevention Program. The wellness program for Zamboanga Peninsula Center for Health Development was also implemented to maintain a healthy and agile workforce. For health emergency preparedness and response, along health emergency management, 87.5% or a total of 63 out of 72 local government units were institutionalized with disaster risk reduction management in health systems. This accomplishment is 47.5% higher than the national target of 40%. Further, all LGUs were also provided with technical assistance on the institutionalization of DreamH systems. For epidemiology and surveillance program, a total of 146 epidemiological and public health surveillance reports were generated and disseminated. A total of 74 outbreaks and health events of public concern were investigated, and a total of 93 technical assistance, capacity development, and other support were provided by the Regional Epidemiology and Surveillance Unit. For convergence efforts, interagency efforts were strengthened to rally for support in different areas as evidenced by the passage of the following. 5 Regional Development Council resolutions were passed. It included the following: the establishment of the Emerging and Re-emerging Infectious Diseases Collaborative Committee to discuss, prepare, assess, monitor, control, contain, and prevent the spread of future arid outbreaks and pandemics. Formation of the Adolescent Health and Development Technical Working Group tasked to support and complement interventions for adolescents. Adoption of healthy workplaces, support for supplemental immunization activity for measles rubella, and endorsement of the 2024 health sector budget. For health promotion, in 2023, 5 local government resolutions supporting health promotion initiatives in the locality were passed. 33 community playbook people-focused activities were conducted. 3 out of 3 provinces were provided with funding support for healthy communities, and 2 provinces, namely Zamboanga del Norte and Zamboanga Sibugay, were provided with grants for healthy learning institutions to cover a total of 64 last-mile elementary schools. Under the Health Facility Enhancement Program, infrastructure support were provided to 35 barangay health stations, 3 rural health units, 2 LGU hospitals, 13 super health centers, and 1 military hospital. Further, 8 LGUs were provided with ambulances, while 1 LGU hospital and 13 super health centers were also provided with medical equipment. More than 327 million pesos were invested for Health Facility Enhancement Program in 2023. For regulation and licensing, in terms of health regulation, 488 applications for permits, licenses, or accreditation were processed within the Citizen Charter's timeline, while 622 facilities and services were monitored and evaluated for continuous compliance to regulatory policies. Both indicators exceeded the 2023 target of 92% and 98% respectively. Finally, a total of 31 LGUs and private hospitals were covered with the medical assistance for indigent and financially incapacitated patient program. A total of 347 and 73 Filipino patients were served and more than 461 million pesos were disbursed. Looking ahead, for fiscal year 2024 and the medium term, the Zamboanga Peninsula Center for Health Development shall endeavor to align with the 8-point action agenda which espouses to make the universal healthcare a felt and tangible reality para sa bawat Pilipino, bawat komunidad, at bawat health worker at institusyon. We shall sustain service delivery by providing infrastructure, medical equipment, and ambulances through HFEP, and provide continuous support to public health programs with focus on the following. For National Tuberculosis Control Program, strengthen engagement with private physicians and other health professionals to address the difficulty of follow-up treatment of notified TB cases to address the gap in achieving the treatment success rate for all forms of TB. We shall continue to provide TB chemotherapy drugs, strengthen laboratory networks to ensure early detection of cases, and ensure continuous capacity building activities for health workers and other partners. For National Immunization Program, reinforce routine and supplemental immunization to increase the rate of fully immunized children. We shall ensure that immunization logistics will continually be provided and technical assistance for macro and micro planning, advocacy, and supportive supervision shall likewise be strengthened. For HIV/AIDS Control Program, strengthen HIV testing coverage and enrollment to antiretroviral treatment, address HIV stigma and lack of knowledge through health literacy program, increase allocation and strengthen advocacy to address the shifting burden of disease from communicable diseases to non-communicable diseases, including premature mortality due to cardiovascular diseases, cancer, chronic respiratory diseases, and mental health. Facilitate the operationalization of the Zamboanga City Drug Abuse Treatment and Rehabilitation Center, the Regional Water Testing Laboratory, and Regional Blood Center. Upgrade Level 1 DOH retained hospitals to Level 2 facilities. Continue to provide all congressional districts with one super health center until all districts have been saturated. Provide support to Zamboanga City Medical Center as the lone apex hospital in Zamboanga Peninsula to become a specialty center for heart, lung, kidney, cancer, and etc. Continue the deployment of human resource for health from National Health Workforce Support System to identified priority areas. Deploy physicians from the Residency Deployment Program to LGU Level 1 hospitals. ZPCHD will operate the Public Health Laboratory to cater diseases of public health concern and continue to advocate the implementation of the Evolution Transition Plan. Much has been done, but much still needs to be done to continually guide the integration of local health systems into the province-wide and city-wide health systems in Zamboanga Peninsula. Nonetheless, the challenges we have encountered afforded us the opportunity to grow, to spark innovations, and to forge partnerships in the region. As we reflect on these accomplishments as well as the challenges, we see the dedication of the men and women of the Zamboanga Peninsula Center for Health Development to lead the healthcare system in the years to come, to ensure the constituents of Zamboanga Peninsula shall have access to quality, affordable healthcare services as envisioned by the universal healthcare. We shall continue to endeavor to place every Filipino in Zamboanga Peninsula at the heart of healthcare reforms. We shall promote community health and strengthen healthcare institutions and the well-being of all healthcare workers. While doing this, we shall hold fast to humanistic leadership approach to demonstrate genuine empathy, care, and support for others. We shall adhere to good governance and call on all stakeholders to ensure that health commitments are judiciously pursued and health services are provided with the highest quality standard possible.
Moving forward, for 2024, our goal aligns with the Department of Health's 8-point action agenda, which sets the overall policy direction for the health sector from year 2023 to 2028. This approach will lead to better health outcomes, stronger health systems, financial risk protection, and improved access to quality health services at all levels of care. Ang DOH ay may hangarin at bithiin. Una, para sa bawat Pilipino. Pangalawa, para sa bawat komunidad. At pangatlo, para sa bawat healthcare worker. We will work to ensure that every Filipino reaches the best possible state of health by offering safe, patient-focused care while making effective use of modern technology para ramdam ang kalusugan sa bawat Pilipino. Through our Love for All activities, we will provide healthcare services and laboratory examinations to 4,374 residents of Zamboanga. For the Bagong Pilipinas Serbisyong Fair, we have served a total of 5,471 kababayans from the different barangays in the region. But we don't stop there. We have also established partnerships with various hospitals across the region to help residents of Sampen with financial difficulties for their medical needs. We have established a total of 10 malasakit centers and partnered with 45 health facilities, providing medical assistance to indigent and financially incapacitated patients, releasing more than 600 million pesos. We have deployed human resource for health across Zamboanga Peninsula, prioritizing the GIDA and hard-to-reach areas of the region. We have also deployed medical specialists and doctors to the barrios, to the different provinces, to better serve the needs of our kababayans. Through the Health Facility Enhancement Program, we have constructed super health centers, rehabilitated rural health units, and barangay health stations, and improved the service capabilities of our public health facilities in different provinces. We also provided ambulances to our health partners to better respond to their health emergency needs. We also opened 4 Bukas centers in the region, and we will be opening one in Sulu, providing urgent care and ambulatory services to our kababayans. Our goal is to develop communities that are ready for any crisis. We aim to ensure a responsive and resilient health systems and communities that can effectively prevent, prepare for, respond to, and to recover from public health emergency and crisis. Following the Ottawa Charter for Health Promotion, we aim to address social determinants of health, improve the healthy behaviors by promoting health-enabling settings, implementing healthy public policies, and enhancing health literacy. There is no health without mental health. DOH aims to ensure that every Filipino cares for themselves and cares for others. We are also investing in traditional and alternative health care modalities for a more holistic and comprehensive approach to health. Ninanais ng DOH na pangalagaan ang kapakanan at karapatan ng bawat health care worker. Hinahangad ng Department of Health na ang ating healthcare system ay handa sa anumang pandemya. Ang DOH ay nag-invest sa ating disease surveillance program at sa ating mga laboratorio para sa mas mabilis tayong makaresponde sa anumang banta ng disease outbreak. The DOH, together with its partners and stakeholders, aims to make Filipinos among the healthiest in Asia by 2040. Let us work together towards this mission dahil sa Bagong Pilipinas, bawat buhay mahalaga.
Thank you very much po, Doc Brillantes, for a very comprehensive po na report po ng Department of Health in Region 9. With that, we will now entertain questions from our media partners. But first of all, we will read the questions po na sa mga media partners natin na nakatutok online, and then we will proceed with the questions from our media partners here in Zamboanga City. So first, we have a question from Zamboanga del Sur. Doc, earlier this year, in-intensify ng DOH ang polio vaccination nationwide, especially sa Zampen. To note, yung campaign is mag-end this July. Ano na po ba ang current status natin dito? Ilang porsyento na po ba tayo sa ating target sa mga batang nabigyan ng bakuna kontra polio?
Okay, Mayor. Sa tulong ng Panginoon at saka sa lahat tayo dito, especially with our media partners in helping us promote the supplemental immunization for polio, we were able to reach, as of this date, 93%. So our target of 95% for the end of July, may 2% na lang tayo na hinahabol, or more than 2% para mas maganda.
Okay, thank you very much, Doc. Doc, follow up, in provinces like Zamboanga del Sur, challenging para sa mga health workers natin to reach the grassroots to deliver healthcare services kagaya ng bakuna. Some of the communities find it difficult na tanggapin ang mga services na ito. May iba hesitant, yung iba nire-resist talaga, considering their tradition and culture. Ano ba ang mga pamaraan ng DOH to facilitate the acceptance of these services in communities with such traditions?
Okay, hindi talaga natin maiiwasan, no, na may mga nandoon pa rin yung mga hesitancy, especially for the vaccination, and also may mga religious belief. But we are working closely with our local government units, especially in the barangay, na sila mismo ang lalapit doon sa mga, ilan na lang naman itong mga tao na ito or families na ito na pwede natin i-convince, or we have a lot of strategy with the local government units. And second is we have to strengthen our health promotion. We will continue our advocacy for this vaccination and even in other programs. At saka sa kagandahan ngayon, Mamair, no, is may bagong program na ini-introduce or strategy ang ating Secretary of Health, especially yung purok kalusugan. So he wants that the services will be translated, or talagang ilagay talaga in the purok areas, kasi we are in the barangays, may mga ibang mga purok leaders, and ito yung magandang approach siguro, especially with the different DOH program, especially doon sa pag-convince and to give information sa ating mga families, mga nanay, tatay, at the purok level.
Thank you, Doc. Still from Zamboanga del Sur po, this coming July 11 marks the first-year anniversary ng ating regional launching of the Philippine Multi-Sectoral Nutrition Project. Any notable developments, achievements po that we can share galing sa mga implementing municipalities?
Okay, for the whole region, we have 9 municipalities that will be implementing, no, the Philippine Multi-Sectoral Nutrition Project. And although 9 lang sila, but we are also encouraging the rest of the provinces na hindi kasama sa project to be included, and wala namang iniiwanan, no, especially with our PPAN, no, Philippine Plan of Action for Nutrition. And with the 9 municipalities, they were able already to do benchmarking, especially doon sa mga children na kasama dito sa project. And we will be, and in fact, this is partnered with DSWD sa kalahi nila, and they were already, as per report during our last month's meeting, that all of the deliverables ng DSWD, kasi mas madali ilun sa kanila, were already implemented. And all of these 9 municipalities have already submitted their plan, and all of them has passed the assessment, and they will be provided, no, the DOH will be downloading the funds, the technical assistance funds for this municipality to implement their municipal nutrition action plan.
Next question naman po ay manggagaling from Basilan. Doc, bakit limited or nawawalan ng supply for anti-rabies vaccine, especially for Isabela City?
Can I request, Doc Noy, please, mas technical ang kuan doon. I will be giving you to Dr. Manolo Alpici, our local health support division, kasi under sa kanya yung rabies program.
Go ahead po, Doc.
So regarding po sa tanong natin na we acknowledge there is a tight supply of rabies vaccines not only for the region but for the entire country, especially the anti-rabies vaccine. But we have already coordinated with the central office for the downloading of additional ARV vaccines to the region, and we have already procured in the amount of 4.2 million pesos, ARV vaccines. This is for delivery within the month. Last week, we have already distributed to the various animal bite treatment centers the last supply of ARV vaccines here at the regional cold chain. So nasa mga animal bite treatment centers na po yan sa lahat ng mga municipality at syudad ng Zamboanga Peninsula.
Okay. Thank you, Doc. We have one last question po from our online viewers. This is from Zamboanga, Sibugay. May vaccine po ba or anti-venom na available sa mga health centers kahit dito po sa Zamboanga, Sibugay?
Okay. Isa yun it is not a problem only sa CHD dito sa Zamboanga, but it's a nationwide na because of the limited supply ng anti-venom, we don't have any anti-venom here available in the region. Ang available lang ng anti-venom is in RITM in Metro Manila. And this is because ang shelf life ng vaccine ay talagang very short, na if we have to stock it here sa Zamboanga, baka aabutan lang ng expiry. So we have ang available dito sa anti-venom is in RITM.
Thank you po. Maraming salamat po sa mga questions natin via live stream. You can still send in your questions po via comment. So we will try to entertain po later on yung inyong mga katanungan. We will proceed now with the questions from our media in Zamboanga City. First, we have a question from Sir Dan Toribio of Marino News FM.
Good morning, everyone. Doc, actually this is the query of those who are residing in the far-flung barangays. For the information of the public again, Doc, do we have free medicines in our health centers? Free medicine sa health centers.
For the health center, number one, because of devolution, health centers are already under the helm or the administration of the local government units. Although we have some augmentation of the medicines, but I am not sure what kind of medicine is she referring to. If it is for public health, like prevention, no, we have deworming, yung mga pang-antenatal, no, prenatal na mga iron supplementation, and the rest ng mga public health, especially if it is public health, we are providing our local government units, our RHUs with medicines. But for the rest of the medicines, hindi na namin kung if they have available.
How about, Doc, for maintenance for high blood and diabetes? Do we have?
We are also providing, again, no, this is augmentation only, especially metformin for diabetes, mga losartan, and amlodipine to the different health centers. But alam mo, sa kadami na ng mga nagkasakit, no, especially hypertension, diabetes, minsan siguro nauubusan yung mga health centers.
Yes, Doc. My next question is we are already under La Nina. So how ready are we to face problem like leptospirosis?
Yeah, as early as the announcement ng La Nina, we have already deployed some of our logistics, no, especially for leptospirosis. Yung mga meds namin na we already deployed them to the different health centers para in case na may mga flooding experience na especially during these heavy downpours, then they can distribute this prophylaxis medicine to the different communities.
Doc, last Sunday, Senator Christopher Lawrence Bongo, the chairman on Committee on Health in Senate, was in Zamboanga. And he was reporting about that you were mentioning a while ago about super health center. Ayon po kay Senator Bongo, Doc, sa mga super health center daw pwede nang manganak. Correct me if I'm wrong, Doc. May policy tayo na lahat ng mga nganak hindi pwede sa health center, dapat sa hospital. So, paano po yun, Doc, sa super health center?
Sige, para mas maliwanagan tayo ng mabuti, I can, Attorney Tim, please, can you answer that question?
Thank you, Director. Good morning to all. Super health centers are primarily classified as birthing homes. Part of their services in the super health centers are for birthing services. So even though they are considered as super health centers, they still would have to apply for a license to operate, which will then allow them to provide birthing services. When we talk of birthing services, they are now allowed to cater to normal deliveries, uncomplicated deliveries. So kung yung mga nganak is normal in nature, they can now go to our licensed birthing homes and have their deliveries there. Except for primees, yung first time mga nganak, and those multigravids, yung mga 5 pregnancies already. They're considered already high risk. So they should already go to the hospitals.
Thank you.
Thank you po. We would like to remind again our media partners to stick with one question and one follow-up. Next question will be coming from Ma'am Leti Melitante of Daily Zamboanga Times.
And Zamboanga Today po. Good morning, Dr. Joshua Vicente and gentlemen. I understand you have millions of budget for the different programs, projects, and activities. Earlier, Doc, nalaman ko, no other than from DOH Secretary, na we don't have funds for the outcoming or for new virus strength. Wala po tayo para budget sa vaccine. So, tanungin ko rin ulit sa inyo, how true po na wala tayong budget for new virus?
Hindi, sinabi na ng secretary na budget. But anyway, kasi maybe what the secretary is referring, especially na wala pa naman yung virus. If ever there is a virus, mayroon naman tayong a quick response fund ng gobyerno na pwede gagamitin in case na bibili tayo ng virus for any outbreak or any pandemic, kung yun man ang iniisip mo. But for the current vaccines that is routinely provided by DOH, mayroon namang budget and it is available.
Ano po ngayon ang status natin in as far as COVID period is concerned? May cases na po ba tayo dito sa Zamboanga City? I understand in Metro Manila may mga cases din.
So far in our region, wala pa naman kasi continuous pa rin yung pagtitest natin, no? Paglaran ng especially if it is related to COVID, kasi nandoon na yung mga laboratories natin. So far wala tayong report na COVID confirmed cases dito sa Zamboanga Peninsula.
Okay, lastly, Doc, how true, Doc, na yung vaccine na tanggap natin first vaccine tapos yung booster, na kung meron daw ibang, kasi ang virus nag-mutate po yan siya into another virus, di po ba? So how true, Doc, na hindi na po daw ito effective kung sakasakaling may makaroon ng bagong virus? How true po?
So far, sa ngayon kasi lumalabas yung maraming variants, di ba, ng COVID-19. Still, our vaccine is effective for that variant. Unless kung may bago talaga, no, hindi lang siya variant kasi pag sabi natin variant, that yung original ay nandoon pa rin pero nag-change lang siya ng like parang isang tao na nag-change lang ng damit, no? So effective pa rin yung vaccine natin. Kaya when new variant came, protected na, hindi na natin makikita yun na nagagabi, lumala yung sakit because may protection na rin tayo.
Right now, sir, meron pa tayong stock sa vaccine.
So far sa ngayon, wala na tayong stock sa vaccine.
Okay, thank
For
you.
COVID ha, for COVID.
For COVID. Okay, thank you po.
Thank you, Ma'am Letty. Next po, Sir Algie Rojas of RPN.
Hello, Doc. Good morning. Good morning, Coral, di atong mga media friends también. Doc, yung question ko po, Doc, is regarding po sa HEA or Health Emergency Allowance. Meron na po ba naka-receive, particular sa ating mga health workers dito sa Zamboanga Peninsula?
Naka-receive? Lahat ng mga health workers that were identified or uploaded doon sa system because ang LGU yung mga identified nila na mga hindi lang yung mga health workers but even yung mga barangay yung mga tanods and all of those na tumutulong especially in their quarantine facilities, in their isolation facilities, if they were identified and they were included in the list ng LGU, lahat sila have already received. Pero kung uunahan na lang kita na hindi lahat ay nababayaran, we are still waiting for additional funds sa office so that we can pay the 2021, 2022, 2023 health emergency allowance.
Okay, sige. Ang next question ko din po, sir, regarding po yung kamakailan lang po, yung mabilis na pagdami ng kaso ng STSS or Streptococcal Toxic Shock Syndrome sa Japan. Dito po ba sa Pilipinas, dapat po bang higpitan yung mga paliparan, yung galing sa Japan din po? Ano po yung other update sa DOH?
Sige. Number one, yung Streptococcus is not a virus, it's a bacteria. So, kung virus, tulad yung flu, yung COVID, yun ay malakas or it can spread, mabilis siyang mag-spread. Pero pag bacteria, hindi siya, it will not pose or any risk of epidemic or spread. So, hindi na kailangan natin na babantayan yan.
Okay, sige.
Especially sa mga airports, ha?
Okay, Doc. Sige, Doc. Thank you.
Thank you po. Next question from Sir Efren Mamak of GMA.
Good morning po, Doc. Kamusta po yung cases ng animal bites and how do we address now? Kasi may naririnig kami sa City Health na parang may kakulangan po ng mga bakuna para sa mga nakakagat ng aso at pusa.
I think it was answered by Dr. Alpiche a while ago. Doc Noy, can you elaborate further?
Thank you, RD. Kadalasan po, we normally have increase in animal bite cases, especially in hot months, March, April, May. So we are already in the wet season starting sa June. So we should expect na meron tayong decrease in the animal bite cases all throughout the region. But we are confident our animal bite treatment centers can accommodate and manage these cases. Yearly, meron po tayong mga tinetrain na mga nurses for animal bite treatment centers. And also yearly, meron po tayong hinihikayat na mga local government units to put up animal bite treatment centers in their municipalities. So we also provide certification. We also provide training support sa ating mga local government units. Aside from that, after train namin, binibigay namin sila ng certification, we also provide free vaccines. Sabi ko nga po kanina, we have tight supply of ARV, not only in the region but for the entire country, but we have already distributed our supply here at the regional cold chain to the ABTCs, and we are expecting delivery po ng local procurement, ng regional procurement ng ARV, and also we are in communication with the central office for the downloading of additional ARV. Meron po tayong rabies immunoglobulin as well sa mga animal bite treatment centers. So si ARV is active, si RIG is passive. So hindi po lahat ng bakuna na binibigay sa animal bite treatment centers ay tight ang supply. Only po ang ARV, the RIG or rabies immunoglobulin, ay very much available and adequate po ang supply sa lahat ng mga ABTCs ng Zamboanga Peninsula.
Thank you po.
Thank you. We have next question still from GMA Regional TV from Ma'am Criza Dapitan.
Hi po, good morning. Ano lang po, regarding ho sa upcoming La Nina season, upcoming rainy season ho, or rainy season naman na ngayon. What are the diseases na pwede natin i-expect this rainy season? And per data ho pala, ano ho yung pinakamataas? Kung ano ho pinakamataas na sakit during rainy season, and ano-ano po yung mga sakit during this season?
Okay, for rainy season, number one, nandun pa rin si upper respiratory tract infection. Yun pa rin ang number one na mga case, yung mga kalintura, ubo, sipon, yun pa rin ang number one, no? And then, aside from that, although hindi naman ito chronological order, but we are expecting also dengue fever, no, especially during rainy season. Then we have leptospirosis, then gastrointestinal diseases ay lumalabas din ito during rainy season.
For the record lang ho, gaano ho tayo ulit ka-prepared for this rainy season?
Okay, based doon sa kung saan yung at risk, no, especially at risk of mortality or death based on diseases. Kasi pag upper respiratory tract, pwede mo na lang water therapy, pwede na yan. But for dengue, we are already providing our local government units, no, yung mga number one is yung mga promotional materials. Kasi mas importante yan para we can siguro convince and change the behavior of our communities. Then we are also providing logistics like mosquito nets treated, and then we have yung mga window screens for the schools. And then we are also providing mga insecticides, no, para sa mga adult mosquitoes that especially for LGU na kung saan may outbreak of dengue, na they can provide fogging. And also in the health facilities, we are providing also some rapid test, no, NS1 ang tinatawag nila doon. It's a rapid test to determine kung may dengue infection. And also our hospitals, we already providing them advisory on the fast lanes na kung may symptoms of dengue, dapat yun ang unahin.
Thank you po. Next question will be coming from Ma'am Julia Lipala of Philippine Daily Inquirer.
morning. I will not be asking a very difficult question. Doc, you made mention about the healthy Filipino for 2040 in Asia. So I just want to bring that to the regional level. Like now we are observing Nutrition Month, diba? So pwede bang malaman how is the nutritional status or the nutritional situation of the Zamboanga Peninsula region? And which part of any cities or provinces we consider the healthiest? Yun po.
Okay, for nutrition, kaya we were included especially in that ADB funded or loan project. And isang for the indicators ng nutritional status, we use yung stunting at saka yung
Wait.
yung wasting, especially ng mga bata. So, we include na yung 9 municipalities in Zamboanga del Sur and Zamboanga del Norte kung saan mas mataas yung prevalence ng wasting at saka stunting. So doon nakakonsentrate yung programa natin for the nutrition. And we are continuously monitoring and doing the yung weight and height measurement, especially among the preschoolers and infancy. And second, we are strongly implementing the 1,000 days, especially doon sa mga buntis until sa pagpanganak until yung mga babies na they will be provided with advocacy learning sessions, especially at the level of the health centers. And aside from that, we are also deploying nutritionists and dietitians in the different municipalities and provinces to assist our LGU in their program for nutrition.
So may pondo po ba sa mga additional nutritionists and dietitian? And second, how do you find the eating lifestyle ng mga, like in Zamboanga Peninsula, we have this wave of different culture ng pagkain like Korean, Japan, ang daming mga sweets na nag-sprout. Nakakatulong po ba yan? Can we really achieve that kind of goal for 2040? Especially sa region natin, ha?
Yeah, actually, yung mga introduction of iba-ibang foods, may mga milk tea, may mga juice. In fact, we are awaiting for that Republic Act, especially on the sweeteners, na dapat i-regulate na siya, especially na hindi yan ay hindi balance or hindi appropriate yung mga vitamins and minerals, especially yung micronutrients na kinakailangan ng ating mga Filipinos. And in fact, for the nutrition, we are also advocating and promoting yung Pinggang Pinoy. Pinggang Pinoy? Yeah. That in every diet, there should be more of fiber, foods, vegetables, and then fruits, and then less of carbohydrates and sugar.
Maraming salamat.
Thank you, Ma'am Julie.
Thank you, Ma'am
Few
Julie.
more questions na lamang po. Next is from Ma'am Tess Espartero of TV11.
Doc, buenos dias. Doc, may question. Update the dengue cases region-wide. Yasubi ba, Doc? Increasing ba this time? Si increasing man, Doc, from January up to present, cause a month alien increase.
Yeah, if comparing it to the last year of the same period, from January to June, there is already a 4% increase of dengue cases. Although we are closely monitoring it and we cannot see wala pa tayo doon sa threshold na epidemic threshold, but we are already front-loading our logistics to the different areas, and we are closely monitoring also with the local surveillance units, especially sa mga LGUs, to give them updates and to provide advisory, especially when we can see very steep increase ng cases.
Okay. Dok, total po ng cases ng dengue itong year.
Nasa 8,000 plus na tayo sa ngayon.
Out of it, Dok, ilan po yung namatay?
We have, I think, 4 reported deaths.
Region-wide po?
Yeah, region-wide.
Okay, Dok, pahabol yung tanong. Sabi niya po, Dok, ano po yung number 1 cases na nakakamatay ngayon kahit po hindi tag-ulan?
Hindi.
Sabi niya, baka pera daw, Dok.
Hindi tag-ulan.
Joke.
Anong hindi
Hindi,
tag-ulan?
Dok, sige lang, joke lang po.
Ano daw po yung sakit na mataas ngayon on death rate po?
Especially on death rate. Okay. This is between dengue and leptospirosis. That's why we are really intensifying, especially yung prophylaxis kung nakakababad ka doon sa mga flood, kasi mas mataas ang mortality rate ng leptospirosis kay ni dengue. Si dengue may especially na matagal na yung dengue, our hospitals, our clinicians, alam na nila kung paano i-manage ang dengue. But for lepto, mas mataas talaga ang mortality of leptospirosis. That's why yun ang concern natin.
Okay, next question po from Sir Regino de los Reyes of RPN.
Hello, Doc. Good morning. Good morning. I am Rino Santo from RPN Zamboanga. So Doc, follow-up question ko lang yung kasama ko, with regards sa HEA kasi po. So, based in mga information na tanggap ko, gusto sila malaman kung kailan po yung tawag do schedule o payout tawag nito. Kasi yung iba, ang alam nila, yung previous na 2024 na malapit na, hanggang iba, ng ating mga health worker, nag-loan na sila para, siyempre kailangan nila. Reaction, Doc. Ayun, Doc. Meron
Okay.
tayo.
Our Department of Health, kasi ganito yung explain ko na lang konti kung ano yung proseso,
Yes, Doc. Maganda yan.
especially doon sa budget. Kasi the budget will be coming from the Department of Budget and Management. Bigyan nila ng pera yung DOH for the payment of HEA. And even for the other programs. So, hindi naman isang bagsakan yung pagbigay ng DBM ng funds sa DOH, and it will depend kung sino yung nauna na nag-a-upload sa system. Kasi may ibang mga LGU na matagal sila nag-a-upload, so matagal din they will also receive late yung payment nila kasi may mas nauna. But ang assurance lang dito that if their list na ina-upload nila sa system, makatanggap sila ng approval, mababayaran ito. But depende sa funds that we will be receiving. Kasi hindi rin namin pwede na patagalin yung pondo sa amin kasi alam namin na yun ay matagal nang hinihintay ng mga health workers natin.
Yes po, follow-up question. Wala po siguro tayo may problema sa mga requirements galing sa LGU?
For the requirements, hindi na. Wala nang, as long as, kasi ina-upload nila yan
Yeah.
sa system. Kung tinatanggap yun sa system, meaning approved na yun. So, what we will be waiting is the downloading of funds dito sa regional office.
Habol question, Doc. May specific tayo this year, yung payout natin sa
Yes.
this year.
Yeah. within
Ibig
the
sabihin
year.
hindi na 2025, 2024 lang.
And in fact, as of now, tuloy-tuloy yung pag-release namin ng HEA.
Mhm.
But again, depende siya sa first come first serve kasi.
Okay.
Kung sino yung nauna, tapos yun, mabibigyan kami ng pera, mababayaran namin. So, yung late, they have to wait kasi late din sila nag-upload doon sa system.
Yes, nanonood sila ngayon lahat sa'yo. Thank you, Doc. Gracias.
Thank you, sir. Next po, we have from RG Antoinette Go of Daily Zamboanga Times.
Doc, buenos dias. Matanong ko lang po ano yung update sa mga specialty centers, lalong-lalo na po. Kung hindi po ako nagkakamali, heart, kidney, and lang dito sa region kasi para mas maging maayos po yung serbisyo at yung mga mamamayan din na pupunta ng Manila po.
Yeah. For the specialty center, ang identified natin dito is Zamboanga City Medical Center. They already have the cancer center and operational naman yung cancer center nila. And then, yung heart nila, because undergoing pa ng renovation and kuan yung Zamboanga City Medical Center. But ang alam ko is some team, I think on the first quarter ng 2024, mga team ng Heart Center have already evaluated and assessed yung capability and capacity ng Zamboanga City Medical Center to perform open heart surgery and yung non-invasive and then we will also be establishing the kidney center here in Zamboanga Peninsula. So yun ang mga specialty na mga and even yung eye center to be established here in Zamboanga City Medical Center.
Okay, Doc. Ibang ano naman, Doc. Kasi meron ng mga reports na may namatay na regarding po sa vaping. At nauuso po talaga ito ngayon, lalong-lalo na sa mga kabataan. No? So, ano po yung siguro take ng DOH dito at saka siguro i-regulate na ba ang mga vaping shops? I know meron dito, Doc.
Yeah, in fact yun ang isang nakikita din namin, no, as even the DOH na problema because parang every corner meron nang mga vape shop. And I think the government will come up with a regulation, especially doon sa vape. Kasi it will also, even the vape, ang kuan lang doon sa vape kasi wala siyang burning, no? And nicotine content is still nandoon pa rin sa vape. And yun ay dangerous pa rin, especially to our health. So aside from smoking, we are also promoting or advocating, especially on the regulation and kung pwede avoidance nga in the use of vapes.
Next po, we have Justin Bulanon of Radio Piilipinas.
Doc, good morning. According to DOH, patuloy pa rin po ang pagtaas ng human immunodeficiency virus or HIV cases sa ating bansa. Ano po yung mga interventions na isinasagawa ng DOH9 to curb it? At may data po ba tayo ilan na ang cases na meron sa Region 9 at anong city or province ang may pinakamataas na kaso ng HIV?
Okay, I will give you that to Dr. Noy Alpiche because this is a program.
Sige po. Salamat, sir. So, based po sa HIV/AIDS prevention program, ito po ang tinatrack nating mga program indicators. These are the following: diagnosis coverage, treatment coverage, and viral suppression. Ito po yung tatlong program indicators na binabantayan natin. For last year, our national target for these three indicators are 95, 95, 95. But for this year, because of the high target population, national government or through the Department of Health has changed this national target into 85, 85, 85. But for reporting purposes, for last year's accomplishment, ang pinipeg nating indicators would be the 95, 95, 95. So for the first 95, that is diagnosis coverage, for Region 9, we have covered a total of 1,957 PLHIBs. So ibig sabihin 53% po ang merong nalaman nila ang kanilang status. The second 95% is yung treatment coverage. So we have covered 1,063 people living with HIV on antiretroviral treatment, 54%. And then lastly po, tinitignan din natin kung gumagana ba ang gamutan sa kanila sa pamamagitan ng pag-monitor ng kanilang viral count or viral load. For the third program indicator, we have 18% or 197 tested for viral load. For Zamboanga Peninsula, meron po tayong 8 HIV treatment hubs. Kasama na po dito ang Zamboanga City Medical Center, Basilan General Hospital, Marcos Atubig Regional Hospital, Mindanao Central Sanitarium, Sulu Sanitarium, Zamboanga del Sur Medical Center, Corazon Aquino Memorial Hospital, and RT Lim Family Hospital. Itong mga hospital na po ito ay evenly spread sa lahat sa buong Zamboanga Peninsula. Meron po, din po tayong HIV primary care facilities at the rural health unit level. Yung last indicator kung saan nagtatrack po tayo ng viral load, meron po tayong mga RIVDA and Certified Confirmatory Laboratories na nasa Zamboanga City Medical Center, Zamboanga del Sur Medical Center, and Corazon Juanco Aquino Memorial Hospital sa Dipolog City. Meron po tayong additional treatment hubs nag-a-apply for certification. Ito po yung Labuan, George Tocao Hofer Medical Center sa Ipil, and Balangas Infirmary Hospital. So yung gamutan, libre po lahat, binibigay ng Central Office. Included na po dyan ang HIV testing kits, sexually transmitted infectious drugs, infection drugs, as well as condoms and lubricants. Lahat po ng logistics and drugs and medicines na ito ay distributed sa ating mga treatment hubs and primary care facilities ng mga local government units.
Dok, kumusta naman po ang stock ng antiretroviral therapy or ART for our PLHIVs in our region? Ano naman po ba ang stock at hindi naman po ba kinukulang?
For the last quarter, based sa report namin, we have experienced tight supply. But dumating na po ang gamot nung second quarter, so kaagad-agad nag-distribute po kami sa mga gamot na ito sa ating mga treatment hubs.
Okay. Last question po. Even there are complete health services in our regional hospitals, patients suffer because of long waiting time or long queues. May we know ano po ang ginagawa ng DOH to decongest our hospitals in our region?
Okay. As of now, kasi especially that most of our government hospitals, no, like for example in Zamboanga City, yung mga DOH hospitals natin, because they are already implementing yung no balance billing, and also we have the medical assistance to indigent and financially incapacitated program. Karamihan ng ating mga pasyente ay pumupunta na talaga doon sa mga DOH hospitals at tumataas na rin yung queuing. So, because of this, ang secretary natin has come up again with another strategy, yung bagong urgent care and ambulatory services. So it will open, like for example, in MCS, I think they are opening from 8 o'clock until 10 o'clock in the evening to cater all those na kailangan ng mga immediate or ambulatory care. Zamboanga City Medical Center, we will be, I think they already started doon sa Wimso, no, may along yung unahan lang ng Land Bank, San Jose Road, yeah. And then for the rest, for Jose Rizal in Dapitan and Marcos Atubig has already opened also their ambulatory care. And aside from this, we are also we will be also strengthening, although we will continue to strengthen, especially yung mga health centers natin kasi may mga cases na dapat doon lang sa health center sila magamot, no, or they can be managed at the level of the health center. So we are also strengthening our referral system para ma-decongest na rin yung mga hospitals namin na dapat ang nasa hospitals yung mga complicated na mga sakit ay dapat nandoon sa hospital. Yung mga minor lang na mga sakit na pwede na gamutin sa mga health centers, dapat doon na sila.
Thank you, Doc.
Thank you very much po. I think that's all for our questions po dito sa media natin in Zamboanga City. Doc, last two questions na lamang sa ating mga viewers online. First po is from Sergio Peñalosa. How legit po yung mga gamot na binibenta online kasi may nakasaad na no therapeutic advice or claims? Seems vague. Can you recommend that to all who wants to avail?
Yeah, kasi isa ito sa, although this is part ng role na ito ng Bureau of Food and Drugs, but it's parang we Filipinos, mahilig talaga tayo doon sa mga testimonial, no, na mayroon na ngang no therapeutic effects. Kasi hindi naman talaga yan para pang gamot, no, kang halimbawa may mga gamot ng cancer, may mga gamot ng nagka-kidney failure na or nagka-chronic renal failure na, binibigyan pa rin ng gamot. So, our advice is, please visit your nearest health professionals or health facilities so that they can provide you a good advice, especially in treating mga different mga illnesses.
Lastly na lamang, Doc, ano ang preparations ng DOH sa pagbubukas po ng eskwela or balik eskwela?
Okay, in coordination with DepEd naman, we are, especially this time na medyo we are experiencing already rainy season, we are coordinating with them, especially doon sa mga classrooms na kailangan ng mosquito net or yung mosquito or yung chemically treated, no, nets para doon sa mga windows nila. And also we are advocating, especially yung na-mention natin kanina na mga leptospirosis, and then and also to the parents, no, na especially kung may flood, na sana hindi na nila palabasin yung mga anak nila because we have already a lot of cases na nalulunod, drowning incident kasi pumupunta doon sa mga ilog na malakas na yung current ng tubig. And then also we continue to advocate nung especially ngayon na Nutrition Month, yung tamang nutrition, especially sa ating mga anak.
Once again, maraming salamat po sa inyong mga katanungan. At kung meron pa po tayong mga comments live, we would like to request po, no, ang Department of Health to answer the questions po sa ating live stream. With that, thank you very much din sa ating mga resource person. Once again, we have Dr. Augusto Manolo Alpici, Attorney Timothy Galvez, and Engineer Domingo Lusaya. Doc, we would like to hear a closing message from you, from Doc Brillantes.
Okay, ang kagawaran ng kalusugan sa pamumuno ni Secretary Teodoro Herbosa would like to thank for all your presence in today's Kapihan sa Bagong Pilipinas. To the technical team of Zamboanga Peninsula Center for Health Development, to the team of the Philippine Information Agency, headed by Regional Director Noemi Idaga, maraming salamat sa partnership in sharing the good news with our media partners. Muli, maraming salamat at sana samahan ninyo kami muli sa DOH sa mga sumusunod na kapihan at talakayan.
Maraming salamat po once again, the Regional Director of DOH 9. We have a Dr. Joshua G. Brillantes. Muli nagpapasalamat po kami sa lahat po ng ating mga media partners na sumama po sa amin, sa lahat po ng mga kapihan sa Bagong Pilipinas natin. Maraming salamat po. And of course, maraming salamat sa buong team ng DOH Region 9 at sa PIA Region 9 for making this episode possible. With that, nagpapasalamat po kaming muli sa ngalan po ng Presidential Communications Office Secretary Cheloy Garafil, PIA Director General Jose Torres Jr., and PIA Region 9 Regional Director Noemi Edaga. Ito si Myra Espinosa at ito po ang Kapihan sa Bagong Pilipinas.